And so, in continuation of our course in kidney, we are considering the diseases of the kidney. Diseases of the kidney. Of course, disease is the abnormal working condition of the body. And so, the kidney and its function is mitigated by diseases. Diseases will drastically reduce the functions and operations of the kidney, such that its efficacy, ability to perform these functions to which they are known for, will reduce. And so here are the diseases of the kidney. Major diseases. Number one, nephritis. Number two, kidney stone. Three, diuresis. Then four, odema, also known as dropsy or odema. Nephritis, kidney stone, diuresis, or odema, also known as dropsy. These are kidney diseases. So let's look at them one after the other. The first one, nephritis. Nephritis is simply the inflammation of the nephron. From the word nephritis, nephron. You see, when the nephron is inflamed, that is such that it can no longer perform its function, the situation is nephritis. And this is usually caused by bacterial infection known as streptococci. A bacteria known as streptococci is responsible for nephritis. And so what happens is that this bacteria prevents this. Remember, this is the glomerulus. If you recall this structure we produced earlier, this is the glomerulus. So the nephritis, these structures in the glomerulus will become inflamed. It become inflamed. That is, the permeability will increase, making ultrafiltration impossible. Materials to be filtered, as materials that are not supposed to ordinarily pass through the tubules, will now pass. That is, the glomeruli becomes porous. For example, the blood corpuscles, of course, the red blood cell, white blood cell, are not supposed to be among the materials that will filter into the tubule. They are not supposed to be among the glomerular filtrate. But when this situation occurs, you see it happening. So even blood cells will filter into the glomerulus, giving rise to what we call hematuria. 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 Yeah, hematuria is a situation in which blood is present in urine. Blood is contained in urine. That situation is called hematuria. So during urinalysis, this is a test that could be conducted to check if there is any bacteria present in the urine. That is the sample. These are streptococci. Urinalysis test may be conducted for this to ascertain and determine the presence of bacteria. So when there is inflammation of this glomerular filtrate, glomeruli, when it inflames, it can no longer perform ultrafiltration effectively. That is, materials will leak into this place, making that filtration invalid. That is called nephritis. Nephritis is one of the kidney diseases. It is bad. It can be controlled by the individual. Dialysis is one of the remedy. Dialysis is a situation in which a machine is made to perform the function of a kidney. That is, the person's body is connected to the machine by means of tubes. So instead of the kidneys doing this filtration, checking the blood and filtering out waste, the machine will now do that for the individual. That is nephritics. Let's look at the next one, which is a kidney stone. Kidney stone. This is another kidney disease. It's another kidney disease. That is a kidney stone. It's another kidney disease. In kidney stone is a condition in which there are stone-like materials along the tubules. A condition in which there are stone-like materials along the tubule is known as kidney stone. So this, if we have this as our tubule, look at the tubule. So along this tubule, you have stone-like materials growing there. So these stone-like materials will now serve as a blockade along the tubules. That is, if there is a growth, you can see this growth will prevent, if material is flowing in this direction, on getting to this place, there will be difficulty for the material to pass. So that is kidney stone. It prevents effective flow of material along the tubule. And the effect is the individual will experience severe abdominal pain. There will be abdominal pain, difficulty in passage of urine also results. Usually, kidney stone may be caused due to excessive accumulation of calcium, phosphate, or foods rich in calcium mineral. Accumulation of calcium can lead to kidney stone in the tubule, along the tubule. So this can be remedied by drinking excess water. So when water, or drinking enough water, let's not say excess, drinking enough water. When enough water is taken, there is the probability of washing off and flushing this tubule. So drinking enough water can be a remedy. Another remedy is avoiding foods rich in calcium. Since foods rich in calcium sulfate, calcium phosphate can act like as a blockade, avoiding such foods can be of help. Then use of drug. Example, diabinase. Diabinase is a drug that can be used to dissolve the stones. That is kidney stone. Now, for us to determine whether there is a stone along the tubule, a test known as CT scan may be conducted. In medicine, CT scan, computer tomographic scan, that's mean of CT scan, computer tomographic scan, may be conducted to carry out to check if there are stones along the tubule. Remember, in the last we talked about ECG earlier. ECG is a kind of, okay, let's talk about some tests. You have ECG. Of course, this is done in medicine to check tuberculosis. So we've talked about now CT scan. CT scan may be carried out to check if there is blockage along the tubule. Then we've talked about urinalysis. Urinalysis may be carried out to check if if there are presence of bacteria. There are presence of bacteria in urine. The presence of bacteria in urine. Then there are some other tests that can also be conducted in to check the effectiveness of the kidney. Good. The third one is diuresis. Diuresis. This is another, the third kidney disease. Diuresis. Diuresis. Okay, diuresis. This is the inability of the kidney tubules to reabsorb water. The inability of the kidney tubules to reabsorb water. Usually, diuresis can lead to the swollen of body parts. Wherever body parts that water is accumulating will be swollen, e.g. the ankle, the face may be swollen. So when the kidney tubules fail to reabsorb water, diuresis sets in. Can be caused by alcohol intake. Excessive intake of alcohol can lead to diuresis. Intake of alcohol can lead to diuresis, which is the inability of the kidney tubules to reabsorb water. This is a very bad condition. Now, we have this condition called diabetes insipidus. Diabetes insipidus. Insipidus. Okay. It's a situation that we may term this diuresis, that is release of excess water in the urine, release of excess water in the urine, which is may be caused as a result of inability of the body as pancreas, or pituitary gland rather, inability of the pituitary gland to produce ADH. ADH is antidiuretic hormone. Antidiuretic hormone. This hormone is responsible for reabsorption of water by the kidney tubules. So when this hormone is not being produced, it means that water will not be reabsorbed and excess water will be removed through urine. All right, and we'll have the last one, which is dropsy or oedema. Dropsy or oedema. Dropsy is not really, we can say it's a sign or a symptom of kidney disease. It's a situation in which, like I said earlier, parts of the body that become swollen as a result of retention of too much water, accumulation of water, intercellular fluid in the body. That's what we call dropsy or oedema. It's also one of the kidney diseases. All right, now let's talk about your assignment. Assignment number 3, very quickly. Assignment number 3, very quickly. Number 1. Which hormone stimulates the kidney to retain sodium and water? All right, just before this question, let me point your mind towards something. I've talked about antidiuretic hormone. I've talked about ADH, antidiuretic hormone. Another important hormone is aldosterone, aldosterone. These two hormones are important. This one reabsorbs water. This one, aldosterone, performs important function. What it does is it stimulates the reabsorption or production of sodium ion. It stimulates the production of sodium ion and excretion of potassium ion. This is very important. Aldosterone, aldosterone will stimulate the production of sodium ion and excretion of potassium ion. That is what this hormone does. Very, very important to note that. So let's go back to our assignment. Number 1. Which hormone stimulates the kidney to retain sodium and water? Insulin, aldosterone, adrenaline, glucagon. Number 2. What is the term for inflammation of the glomerular kidneys? Nephrosis, nephritis, glomerular nephritis, uremia. Number 3, hematuria refers to the presence of what in urine? Sugar, protein, blood. bacteria. Number 4, dialysis is required when the kidney fails to store urine, produce urine, filter blood, and remove toxins, absorb nutrients. Number 5, which image detects, which image technique is mostly is most commonly used in detection of kidney stone? X-ray, CT scan, ECG, ultrascan. Next one is number 6. What is the main complication of untreated chronic diseases? Diabetes, kidney failure, obesity, asthma. All right, number 7. Which test is most specific for detecting protein in the urine? Urine glucose, urine pH, urine dipstick, urine protein creatinine ratio. Number 8. Hemodialysis removes waste from urine, lymph, blood, saliva. Number 9. Which part of the kidney filters blood to form urine? Ureter, nephron, glomerulus, renal, pelvis. Number 10, and the last one. Which test detects microscopic blood in urine? X-ray, CT scan, urinalysis, ultrascan. So do this assignment procedure. You'll receive a notice in Facebook about this assignment. Indicate presence there. Go to the comment area. You will see when you go to the comment area, you will see this link to this video. Okay, show presence there. Then this video will not take you to YouTube. Subscribe to the YouTube. Touch the bell notification so that anytime assignment drops, you will get to know. Very soon, I'll stop giving you signal in Facebook. I'll just drop it in YouTube directly. And so when you are already with the bell, when you touch the bell, once assignment drops, you notice it. All right. Do this assignment. Very, very important. All right.